Information Sheet 3. Understanding your risk from Covid-19 if you have a rare disease. It can be very hard for people with rare disease to know their level of risk from Covid-19. Having a rare disease means that there are very few people with your condition. Sometimes doctors and health professionals may not know much about it. Some people have many different medical problems as part of rare disease that may increase risk. Other people may not have a diagnosis yet. The UK government sent letters to around 1 million people who are extremely vulnerable to Covid-19. This letter advises them to undertake shielding for 12 weeks. See Information Sheet 4 for more details. However, people with rare or not yet diagnosed conditions who are at very high risk may not have received a letter. The list of patients was made using an automated system based on medical databases. If you are worried that you are at very high risk and have not got a letter, you should contact your GP or hospital specialist for advice. Remember that not everyone with the same rare disease will be at the same level of risk. It depends on the type of medical problems you've had and how serious they are. If you have not received a letter but you think you're extremely vulnerable, you can self-register and get support at this website. Or telephone 0800 028 8327. Also, some people with rare or not yet diagnosed conditions who are not at very high risk may have received a letter. Again, if you're not sure about your risk, you should contact your GP or hospital specialist for advice. Here is some information about how a person's level of risk is decided. Group 1. You're at very high risk for Covid-19, i.e. extremely vulnerable if you, number 1, have had an organ transplant and take medication to suppress your immune system. Number 2, are currently being treated for cancer, such as receiving chemotherapy or radiotherapy. Number 3, you have a severe respiratory condition, such as severe asthma requiring regular oral steroids, bronchiectasis or pulmonary fibrosis. Number 4, are taking a medication which acts to suppress the immune system, an immunosuppressant. Number 5, you have a medical condition which gives you a much higher risk of getting infections. Or number 6, you're pregnant and also have heart disease, including congenital heart disease. Group 2, who are at high risk for Covid-19, or sometimes called vulnerable people. This group includes those who are over 70 years old, those who have a chronic long-term respiratory condition, those who have chronic heart disease such as heart failure or congenital heart disease, those with chronic kidney or liver disease, those with a chronic neurological condition or learning difficulties, those who have diabetes, those who have a medical problem with their spleen or who have had their spleen removed, and those who are pregnant or have a body mass index, BMI, of over 40. We are also putting together advice about some of the more common rare diseases. This has more details about important risk factors for certain conditions. Please see our additional information sheet on rare diseases and risk from Covid-19.